Hello, you're watching Health Day Now. I'm Mabel Jong. We may never return to the normal we left behind in March of 2020, but perhaps that's a good thing. The pandemic laid bare the challenges in delivering mental health care to certain communities. The American Psychiatric Association, under new leadership, will be directing members towards addressing these disparities. With more details is APA President Dr. Vivian Pender. Dr. Pender, thanks for joining us.
Thanks so much for having me here.
Addressing social determinants of health was a major focus of this year's meeting of the APA. What does the serious mental health picture look like in America, and what disparities did the pandemic expose?
Well, COVID exposed major disparities in certain populations, disparities that already existed, but it became painfully clear that Black, Hispanic communities and individuals with mental illness were 3 to 4 times more likely to be severely affected by COVID. Social determinants are environments that negatively impact mental health. So during my year as president, the APA is establishing a task force on the social determinants of mental health. It'll use a public health approach to focus on prevention of these risk factors. And the APA task force will produce educational tools to raise awareness and policy guidelines for legislators and research development for industry. What we really need is funding for education, research, and more integration of mental health into healthcare.
Now, in terms of the loss that many people experienced this year, do you believe that more people are now at risk for mental illness?
What happens when there's a traumatic event in an individual, there are kind of stages, they're like stages of grief. First, there's protest and shock and denial. You know, why is this happening? How is this happening? And then in an ideal world, we move on to acknowledging, well, it did happen. And then there's reconciliation. Okay, it happened. Now, what do I do? What kind of plans do I make? How do I manage or deal with what's happening here? So that's, I think, happening to everyone. For those people who have acknowledged that this has gone on, there's still been a tremendous loss. You know, loss of the way of life, their way of life, loss of work, or at least change in work style, and change or loss of relationships as well.
Sure. Now, we've seen an explosion in the number of apps that have become available to people who have had to shelter in place this past year. Have these apps, for the most part, been beneficial to people, or are there concerns that people are not getting the appropriate care they need from this somewhat impersonal and self-monitored form of therapy?
Yeah, that is a great question, because, you know, like many other new changes in technology, these apps have not been well studied. They've not been even documented, all of them. I think there are thousands of them by now.
Yeah.
And they haven't been looked at in a scientific way or subjected to standards or some kind of standardization that to test whether they're effective, efficacious, you know, whether they result in benefit. And I think eventually they'll have to have some kind of, I don't know, rating system, or they'll have to be regulated. There are good ones, benign ones, and then there are untested ones, and ones that may not be helpful at all, and very disappointing. There's and the big thing is there's no guarantee of privacy. So there are some apps that I would at least alert consumers to be careful about apps that are asking you for information about yourself, because they're establishing a database that that is not private, not, at least privacy is not guaranteed.
Mhm.
Um,
Yeah.
so, but then there are benign apps like relaxation and meditation apps, and those are great. I recommend them for all of my patients. But if you're in a crisis and you really need help, then I would say don't go to an app. Either call a crisis hotline or call your primary care physician to get help.
As the COVID-19 crisis ebbs and more people are getting their vaccines, are people out of the woods, or do you believe there will be a long-term impact on people's mental health? And what will that look like?
Some people have kind of reevaluated, taken stock of what's important to them and how they were living their lives, and have redirected the way they're going to go about their future. They've changed jobs and relationships, and they're going in a more positive direction. At least, that's their intent. But nevertheless, I think the general impact of having a worldwide pandemic is going to take a long time for us to reconcile.
Absolutely. Well, Dr. Pender, we thank you so much for sharing your thoughts with us today.
Thank you very much.
Dr. Vivian Pender is the president of the American Psychiatric Association. Thanks for watching Health Day Now. We'll be back with more. According to a poll taken by the American Psychiatric Association, 43% of adults reported that the pandemic has had an impact on their mental well-being. So if you're feeling that your mental health has taken a serious hit this year, and you're even feeling re-entry anxiety about a post-COVID world, clearly you're not alone. I'm very pleased to be joined now by Sherry Amatenstein with her experience this past year. She's a psychotherapist based in New York City. Sherry, it is so good to see you.
Thanks for having me. I look forward to this.
Now, what was life like for you this past year?
It was very difficult for me because I was diagnosed with cancer around a month before COVID started really closing down New York. So I had to be in isolation, go to all my treatments alone. I had to have a COVID test before every chemo. So it was very scary.
Okay, and you've gotten your vaccinations?
I got both vaccines. I got my second one in February. I finished treatment last October. And so I find for myself, and I am not alone in this, a lot of my patients have this as well. It's difficult when, especially when you have experienced trauma and fear yourself, to then venture out and start to live a somewhat quote unquote normal life when things are safer.
Did you feel more confident, though, after getting your shots?
I was very grateful and remain very grateful that I did get my vaccine, but it didn't mean that my life changed very much, at least for a while.
Mm-hmm. Why do you think you're still nervous? After all, you are, according to CDC guidelines, fully protected.
Well, there is actually such a thing as post-COVID stress disorder, which is along the lines of PTSD, because we lived for over a year with such fear and such uncertainty, and oh my God, you can't be around another person. And now all of a sudden, oh, I can see a friend again. And so it's your body doesn't know what to do. Our cues are all mixed up. Suddenly what was verboten is supposed to be okay again. How do you react? So it's when your body has been in such a state of fear for so long, it's very hard to just, okay, life's good again. Take off my mask when it's safe, and I'm good.
Have circles gotten smaller? Maybe people are more selective about what they will do or who they will see socially.
I
Will
think
that be a lasting
yes. I
effect?
mean, I tell people all the time, what are the gains that you've gotten from this? And a lot of times it's because you've learned I can be alone. I was always afraid to be alone. So I would always people my life, even if it wasn't someone I really enjoyed being around. I would do anything just so I wouldn't have to be alone and face the noise in my head. And now that you did that, you can learn to more appreciate time and freedom and what you really do value and enjoy doing in your life. And so for a lot of people, it's allowed them to step back and say, well, I don't just have to be busy for the sake of being busy. I don't have to see Maureen or Sam, even though I don't enjoy being with them because they put me down, you
Hmm.
know.
Interesting.
And
Yeah.
a lot of people have pods, people who they got through COVID with, essentially, so I think a lot of people are still in their pods. Their pods are getting vaccinated, and then you venture out
Yeah.
little by little, step by step. When you're diving into the pool, make sure there's water in the pool.
Right. Well, Sherry Amatenstein, thank you so much for sharing your experience and offering some guidance. And thank you so much for joining us for Health Day Now. I'm Mabel Jong.